Driving phobia is characterized by an intense, persistent fear of driving, which increases as a person anticipates or is exposed to driving stimuli. The onset of driving fear is typically related to motor vehicle accident involvement, panic disorder, or agoraphobia. Virtual reality exposure therapy has several potential advantages over in vivo exposure. In vivo exposure has a number of limitations and risks because exposure occurs on public roadways where driving situations are often unpredictable, time limited, and difficult to control. These problems bring up ethical concerns because they could cause an accident, but they can be minimized with virtual reality exposure therapy because treatment occurs in a clinician's office where it is always safe. The goal of this study is to test if virtual reality exposure therapy will reduce driving-related anxiety and eliminate the fear of driving. To start off, we need to select 25 participants with a driving phobia. These participants will have a pre-treatment session with a description of the treatment, an orientation to the VR equipment and software, and a driving anxiety test. Then the participants will take 2 one-hour sessions a week for a month. This includes a follow-up assessment during treatment at the end of each week and another follow-up assessment 6 months after the treatment is over. Each treatment session will consist of a 5-minute discussion of the virtual reality scenario to be practiced in the session, followed by the virtual reality exposure therapy. During this session, participants will be asked to verbally report peak anxiety from 0 to 100 at the end of each completed scenario. Participants will repeat the scenario over a series of trials until their anxiety level has dropped to 10 or less. Once this is achieved, participants will move on to a more anxiety-provoking scenario. Progression to the next scenario is ultimately under the control of the participants, and they can stop at any time. In the last session, participants will receive the treatment evaluation form to complete as soon as possible and will be asked to repeat the driving anxiety test. The treatment evaluation form provides information regarding the clinical significance of the treatment in reducing driving fears and avoidance. The form should show that participants' peak anxiety decrease after every session. The driving anxiety test will show how virtual reality exposure therapy reduced interference with daily functioning and how the virtual reality exposure therapy was in allowing participants to resume real-life driving. They will have to rate questions from 0, it did not help at all, to 5, it was extremely helpful. Results from the 6-month follow-up interview should also provide clinical evidence for the effectiveness of virtual reality exposure therapy. The results should indicate that driving phobia is in remission. This will provide participants with greater mobility and independence, and they will be able to perform more daily activities. This study should work because there are evidence-based treatments that are similar to this study, but have a lot of shortcomings. One study is the efficacy of virtual reality exposure therapy to treat driving phobia, a case report by J. Wald published in 2000 on the Journal of Behavior Therapy and Experimental Psychiatry. This was a single case study, so it was hard to tell if the treatment's generalizability can be transferred to others with driving phobias. Therefore, controlled clinical trials are needed to see if virtual reality exposure therapy truly has an effect. The results have to be replicated, and this is exactly what my experiment does.